Well, today on the show, we're talking to David Wolf again at Grace HealthCare, and we're talking about a subject that a lot of people, wonder how to deal with it with their insurance companies when it comes to, getting the services needed.
It does. It comes up every day. Everybody has insurance policies or they have Medicare, and we go through this trying to figure out. Most people, and I'll be frank with you, if I weren't in the business, I probably wouldn't know all the things my insurance does, or it doesn't do. And some things that have happened now that they're following suit with the Affordable Health Care Act. So they're becoming more stringent, and the requirements and the authorization and the justification for whether it's a chair like this,
right,
or it's a wheelchair, or it's a hospital bed, it's become more bureaucratic's not a great word to use, but there's more. They're being more
picky.
Thorough, more picky. No, those are good words.
Simple
too.
word. Picky.
Yeah. But I want people to understand that sometimes when they come into Grace HealthCare, I'll say this: it used to be a lot simpler. A 4x4 card from your doctor, and a lot of times we could just go out and we could deliver it right then and there. Well, the fact is, if we get a 4x4 and it says wheelchair from Dr. Smith or Dr. Jones, I'm throwing out those names, but if we get that 4x4 now, we can still send it out there. But if we don't get the authorization in line first, oftentimes we'll have to come back, and we may end up having to bill the patient, or you may find out. And what we don't want to do, the last thing we want to do is have any surprises to a patient.
Right.
If you get this, when you come into the store and you look at this chair, we're going to tell you, okay, Medicare will cover this amount. You're going to have to cover this amount
out of pocket.
This amount out of pocket.
Right.
This is your deductible. Now, in fact, coming up through the next 3 months, chances are your deductibles have already been met. It's a wonderful time if you were thinking about, gosh, I've had this wheelchair for 5 years, I can get another one. Great time to think about doing it prior to January, because
you have to start all over again.
You start all over, and we have seen so many people with the new private insurance, and that their deductibles have gone they're so much bigger.
They are.
Gosh, yeah. To offer the same policy to an employee, the employers are having to spend more on that. Sometimes they're spending more on a $2,500 deductible policy than a $1,000 deductible policy they used to get, and so it's a tricky time, and you have to take a moment and be patient with learning what your policy can do and what it can't do.
And that's one of the great things about Grace HealthCare is because you'll sit down with the people and you'll say, this is what you got, this is how you're covered, this is what you're covered for, this is what we can do for you.
Yes, sir.
And this is what the insurance company is going to cover themselves.
And it seems like, because they're probably the biggest provider of health insurance in the country, Medicare kind of takes the charge and leads the way, and then the private insurances, the Blue Crosses, the Aetnas, they follow suit. So a lot of the same things that they were looking forward, now we're having to find. There's a new thing called DWO is our abbreviation, but it's called a detailed written order. And there's other ones. So instead of an order just saying wheelchair, now they want a 18-inch wheelchair with leg rest, or with elevated leg rest, or anti-tippers, or it goes down the list of things that a special cushion, but they want a detailed written order.
I guess beverage holders aren't always included in those.
No, not always. No, in fact, they will not pay for those.
That's an option. You can always add that option on.
They will not pay for those, although it'd be very handy to have.
Yeah.
Other thing that there are a lot of items now and this is one that we didn't used to have. Our abbreviation is WOPD, which is written order prior to delivery. So when we used to be able to call, the doctor used to call in, or the nurse could call in and says, per doctor's orders, we want to get a nebulizer sent out for this patient. Well, Often that works if we have a relationship with that doctor and we know we can get the written order. But in most cases, we have to have the written order, physically have the written order prior to us delivering it. Mm-hmm. That's a big step. That's a big step. It's no longer the quick phone call. What's interesting, in a pharmacy situation, a doctor can call in and without a written order. In a lot of equipment, not all the equipment, but a lot of equipment now, medical equipment, it needs that written order prior to delivery. So these are things that we're not trying to be, gosh, we want to deliver the equipment. We want to get it to you as quick as we can. We don't make any money until we do that. That's the honest truth. So it's we're dealing with this, but we sure don't want to end up at the other end because, look, you're already in a position where you need the medical equipment. The last thing you want is an unexpected bill.
Right.
And these unexpected bills, you're going to get enough of them when coming from the hospital or from wherever else you've been. And we don't want to be part of that. We want you to know what you're getting into. So I'm real proud of that. I don't think sometimes, I think there's a way to, I think there's by following up and staying proactive. And this is the thing, sometimes we don't get the paperwork in. We've delivered the equipment and we don't get the equipment in, and we'll have a patient, they'll go 3, 4, 5 months and we've never sent them an invoice because we're waiting on
the insurance company.
We're waiting on the insurance company or waiting for the proper documentation so we can send it to the insurance company.
Gotcha.
And that's on us. And I feel we shouldn't send an invoice until we've got that sorted out.
Right.
And we'll take that risk. We do that all the time, and it's nice. I guess the biggest thing is it's always nice when somebody calls in and what's that deal? Remember, what was that actor? You can connect one to how many people?
Kevin Bacon.
The Kevin Bacon. Everybody's connected.
7 degrees of separation.
Yes.
That's
okay.
what it is. 7 degrees of separation.
Well, look, and I'm gonna make a nice statement here. I want to thank all the Ladners, all the Nicases, all the Socias. If it weren't for those groups right there, I think that's about 40% of our business somehow on the Gulf Coast. But it is wonderful that the degrees of separation, within 2 phone calls.
And Ladners, I'm related to you. So just let you know that my mother was a Ladner. Thank you so much, David. Appreciate the information on that. Of course, if you want more information, numbers on your screen for Grace HealthCare if you need any help from them. Of course, they work with your physicians so well, but they're located all over the Mississippi Gulf Coast. We're at the Broad Avenue location here. Great staff of people. Give them a call at Grace HealthCare.